Welcome to today's video, where we'll be exploring the fascinating world of neuromodulation in critical care. So what is this neuromodulation? Techniques using invasive or non-invasive stimulation at central or peripheral levels to enhance or suppress neural activities. These offer potential therapeutic benefits and have shown promising outcomes in various fields, especially for new therapeutic approaches. What are its applications in ICU? Neuromodulation has gained attention in ICU settings due to its possible efficacy across different stages of critical illness. It is being increasingly used to help manage the complex dysfunctions common in critically ill patients, such as due to sedation, immobility, and mechanical ventilation. Critical illness polyneuromyopathy, or CIPNM, a common complication in ICU patients, leading to muscle weakness, prolonged mechanical ventilation, and increased mortality. There are few specific treatments or preventive tools for CIPNM. Transcutaneous electrical muscle stimulation, or TEMS. It may provide anabolic stimulation to muscles and counteract the catabolic effects of immobilization and critical illness. It has been used as an additional treatment in patients with severe chronic heart failure and COPD. TEMS may also have acute effects on peripheral circulation and muscle metabolism, influencing heart rate, blood pressure, and cardiac output. Clinical evidence for TEMS. A randomized controlled trial of 140 critically ill patients showed that daily TEMS sessions prevented the development of CIPNM and reduced the duration of mechanical ventilation. Results showed a median ventilation time of 1 day in the TEMS group versus 3 days in the control group, with a significant difference, p-value equals 0.003. Need for further research. Some systematic reviews suggest that the evidence supporting TEMS is of low quality and highlight the need for further randomized controlled trials to establish its role as an adjunct treatment for muscle weakness in ICU patients. Diaphragmatic dysfunction in ICU, commonly caused by sedatives, mechanical ventilation, and inflammation. Transcutaneous electrical diaphragmatic stimulation, or TEDS, non-invasive method using surface electrodes placed on the diaphragm. Shown to reduce diaphragmatic dysfunction and improve respiratory muscle strength in ICU patients. A controlled trial with 66 patients showed no significant difference between TEDS and sham stimulation for diaphragm function, suggesting the need for further research. Vagal nerve stimulation, used in ICU as an adjunct treatment, particularly for refractory epilepsy. A systematic review showed VNS interrupted status epilepticus in 74% of cases within an average of 8 days after implantation. Requires more controlled studies to establish its role in ICU patients, including cost-effectiveness and risks. Non-invasive electrical stimulation for coma recovery. Transcutaneous VNS and right median nerve stimulation have shown promise in aiding recovery from coma. A randomized controlled trial showed improved coma recovery scale revised and Glasgow Coma Scale scores with TVNS compared to sham treatment. RMNS was shown to help a higher percentage of traumatic brain injury patients regain consciousness. Mechanisms of action. TVNS and RMNS might work by enhancing neuron survival, improving blood perfusion, and increasing neurotrophic factors in the brain. TVNS has also shown potential in reducing inflammation and modulating stress responses in ICU patients. Challenges and considerations. Practical challenges include patient tolerance, treatment protocols, and potential side effects, like skin irritation, interference with pacemakers or medical devices. More clinical trials are necessary to determine safety and interference with other ICU treatments. Thank you for joining me in exploring these cutting-edge neuromodulation therapies. From enhancing neural recovery to improving muscle strength and respiratory function, these non-invasive techniques are transforming how we manage critically ill patients. As research continues to evolve, we may see these interventions play an even bigger role in the future of critical care. Stay tuned for more insights into the latest advancements in ICU treatments.